goes back to the basic principle of life. The basic basis of all religions is treat people the way you want to be treated yourself, and that's really kind of works for everything. In the Jewish religion, we'd say be a mensch. A mensch is someone that really cares about other people as much or more than they care about themselves. If you do that, you're gonna do the right thing most of the time. So if I would need an hour with a patient, I need to have an hour with the patient. If I need a half hour, half an hour. One of the things I do is if I find someone that really needs surgery, I don't just say, well, you need surgery and you need to walk out of the room. I've developed liaisons with other doctors in the community who I think are really good and well-trained, fellowship trained, and I get that patient into that doctor. So I actually act like a triage nurse at times. But that patient otherwise might call 5-6 doctors and not find anybody that could see them in the next 4 months. And I've had patients like that. I have also some patients that have an insurance plan that's, let's just say it's not the best plan in the world and there's not a lot of doctors on that plan. So I've reached out to some doctors who I know a long time that are very good in that plan, that do surgery, which I don't, and said, hey, if I have someone that's a good patient, a decent person, they have a problem, it needs surgery, it's all worked up, do you want it? And if you want it, can you try to get my patient in a reasonable amount of time? And I've got some good relationships like that. So that's another something I can give to the patient that it's really pretty hard to get anywhere else today. You have two guys that are both 84 years old. They both have arthritis in their knee. Let's say their left knee. Right knee's pretty good, hips are pretty good. And I say to them, well, how does this limit your life? How does this affect your life? I said, do you like golf? And the one guy says, yeah, I love golf and I can't play at all. I would walk the course 5 days a week. In fact, I love golf more than anything in the world and I can't play golf anymore. So that guy probably needs a knee replacement. I'm probably gonna refer him out for that. The other guy says, yeah, I love golf. I sit on the couch, I have a beer and I watch it on TV and I have a good time. Well, that guy doesn't need a knee replacement. He has activity level and expectations where the risks of that procedure outweigh the benefits. Where the other guy, this thing is really hurting his life and mentally hurting his life. And again, as you get older, you have your emotional component is very, very important. For older people, if they get depressed and they're inactive, it's going to markedly adversely affect their general health. And so again, that's another example how we try to tailor not just the X-ray or the findings or the MRI findings or whatever it is, but to the patient. How does this affect this patient? And I think that's something our whole group is very good at.